Hi, everybody. I'm Leslyn Keith. I'm the president of the board of directors and director of research for the Lymphedema Project. And I'm really excited to be here today, as I am twice a month, talking about research that is of relevance to lymphedema. And so I have another good paper that I want to talk to you about today. And it's really being woven into this idea, is being woven into some other things that we're going to be doing with the Lymphedema Project and Lymphedema Simplified. This is also, in the middle of Lymphedema Awareness Month, and I hope you've been able to join a lot of our activities that have been going on already. There's still more to come, and a really exciting thing to come up on June, it is June 24, 25, 26. Coming up is the boot camp. And you can see there the link to register for our boot camp. I'm going to be talking about this topic that I'm going to go over today in our research update at the boot camp, as well as a bunch of other cool presentations and opportunity to network with coaches and other experts in lymphedema. So be sure and find out more about all of our lymphedema awareness activities, as well as what's happening with the boot camp. But today, I'm going to be talking to you about a paper called Lymphedema Treatment Decreases Pain Intensity in Lymphedema. This was a great paper put out by some researchers in Szeged, Hungary. And they published this paper in 2011, actually, in the peer-reviewed journal Lymphology. So it's not super recent, but it is within the last 10 or so years, which is part of that explosion of lymphedema research that's been happening in this last decade. So the aim of this particular paper is they wanted to look at what is the impact of traditional treatment that's used for lymphedema. What kind of impact would that have on pain intensity that women with lymphedema experience? And so in this paper, they described lymphedema treatment as manual lymph drainage. A lot of times you'll see it as referred to as MLD. So manual lymph drainage, which is a very gentle massage technique that is used specifically for people with lymphatic disorders. And then skin care, so special moisturizing and hygiene for the skin, compression bandaging, special exercises. And they also put in their idea of this treatment for lymphedema is a pneumatic pump. And we know that we use that a lot for lymphedema as well. So that's how they describe their lymphedema treatment. And now they want to see what impact that would have on pain for lymphedema. And this is, the authors talked about some other previous research they had done kind of on this similar topic. And what they are hypothesizing is that the excessive fat deposition that we find in the lower body, especially in lymphedema, it could alter the microcirculation of that tissue. And that could mean that we have increased lymphatic load, increased fluid that is trapped in the fat tissue in the lower body. And so in early stages, they say that different imaging techniques on early stage lymphedema shows that we have increased lymphatic transport. The lymphatic system is working hard to keep up with this increased load. But in later stages, we start to get injury and impairments to the lymphatic system in lymphedema, and now it can't deal with this increased load. So then that's what led them to believe, well, okay, so then traditional lymphedema treatment may be beneficial for lymphedema because we now have a lymphatic impairment that's happening. And so in their previous studies, they had found that this traditional lymphedema treatment decreased the limb volume size, not as dramatically as it does in lymphedema, but it did reduce the size. And it also decreased the amount of bruising, which was really interesting. So in this particular study, they had 38 women. Again, another study with a small sample size, but an excellent place to start. And then we can always do further studies. So they had 38 women and they divided them into two groups. And one group had 5 days a week for 1 week they had this lymphedema treatment that included the MLD and the pump and et cetera, et cetera. And the second group only had skincare. They had moisturizer applied daily. So they were, the women with lymphedema in that group were considered the controls to compare to. So treatment and basically no treatment, or just that limited treatment. And then they described each of the groups, and the average age in the treatment group was 54, and the average age in the control group was 56. So very similar in age, but I think it's unfortunate they didn't give any other information about the women in these two groups. What stage were they in? How long had they had lymphedema? So all we have is their average age, and that's pretty unfortunate. But still great information. So the intervention group, specifically what they did for the treatment, they had 30 minutes of manual lymph drainage. They had 30 minutes using a pump, and actually at a relatively low setting, a low pressure setting. It was only 30 millimeters of mercury pressure. And quite often for the lower body, we go up to 60. And so this group, they were pretty conservative. They just used 30 millimeters of mercury pressure. They had this same skincare with moisturizer that the control group had. Then they also used bandaging, and they described the compression bandaging as bandaging with appropriate padding. Unfortunately, another thing that they didn't give details on, how high up the leg did they bandage? Did they bandage both legs to the groin? Did they just go to the knee? They didn't say. And then they exercised by walking twice daily for 30 minutes. And so that was the intervention group. They did all that. And as I said, with the control group, all they had was the moisturizer on their legs daily for 5 days. So then they had some very good outcome measures. So the data they collected was they measured the legs in specific spots to calculate the limb volume. So they used a measuring tape, and then they calculated the limb volume of everybody in the study. They also used pain assessments, and they actually used 3 pain assessments. So they're very, very thorough in looking at the pain in these women with lymphedema. And so the first pain assessment was a 30-question questionnaire. And first, what the women had to do is they had to choose between different descriptors of pain and say which ones, what were the top ones that really described their pain that they experienced. And so it had adjectives like pressing, dull, heavy, pulling, unbearable, exhausting, stabbing. So these various words, they were told to rate those on which ones in a descending order, which ones best describe their pain. And then once we had those, then they picked the top 10, and they had to rate those top 10 on a scale of, I believe it was 1 to 3. And 1, this doesn't really fit me at all. And 3 meant it fairly well. This is a good descriptor for me. And then of those, they then had to then rate those on a scale of 1 to 4, meaning that of this type of pain, I have 1, not really any pain of that type, but 4, pretty severe. So they can go from 1 to 4 on the severity of each of those different types of pain. So got very descriptive in the pain. They also used the typical pain rating scale that you might have had experience with, and that was a scale of 0 to 10. 0 meaning I have no pain, 10 meaning the most severe. And they did another one, it's called the Wong-Baker Faces scale. And this one you probably have seen, like if you've gone to the emergency room and they pull out a thing that has these 10 faces, and a smiley face, 0 pain, all the way up to, crying and sweating because you have that 10 level pain. And so you can give a numerical value, or you can just point to the face that seems like this is how I'm experiencing my pain. So they really got into very much quantifying and qualifying the pain that the women in this study were experiencing. And so they did all those measures before they had the intervention, and then they repeated again after the intervention. And the results were kind of how I would have assumed the results would be. There was one little interesting outcome that I wasn't expected, but largely the treatment group that got all of those interventions had decreased leg volume, and it was a significant amount of leg volume decrease. And the control group did not have any decrease in leg volume. And that's kind of expected. You expect that you're doing compression, you're doing exercise, you're doing MLD, you're doing the pump, you're doing all these things, and the other group is not getting in those things, and they didn't get a reduction. But what was interesting was that as far as pain went, the intervention group had a significant reduction using all of those pain measures. The group that was only getting the lotion, interestingly, on the one pain scale, the pain rating scale, where they would rate it from 0 to 10, they had a significant reduction in that one scale, but not the others. So, there's a benefit just to putting lotion on your legs, but not as much of a benefit as when, at least for this study, is when you were doing a full lymphatic treatment. So the authors conclude from this that this demonstrates that complete decongestive therapy or traditional lymphedema therapy used for lipedema can have a really good benefit, not only in reducing leg volume, but also for reducing pain. And their previous studies, they had found that it reduced bruising, and it already had reduced leg volume in a previous study. So and they believe that the reduced heaviness type of pain and joint pain, maybe this was reduced when we got out some of that extra lymph load, that extra fluid that has been trapped in the tissues through this lymphedema therapy. So a couple of things that I just would have loved they would have done is I talked about more information about the women in the study, what stage were they in, how long have they had the lymphedema, and then how high up the leg did the bandages go. And then another thing that would be really interesting to look at is, now let's look at which components of traditional lymphedema therapy are the most effective for specifically pain for lipedema. So was it the MLD that helped reduce the pain? Was it using the pump that helped reduce the pain? And I think there has been some good research with those individual components and not so much as the program as a whole. And so that is going to be included in my talk that I'm going to give with the lipedema boot camp that we're having on June 24, 25, and 26. I'll be talking about different ways to manage your lipedema pain. And one of them is going to be through CDT. And I'll be talking about the different components of complete decongestive therapy and how each of those components can have an impact on your pain. I just think that this paper was super wonderful because we are seeing that traditionally treatments that we do for lymphedema can also have a really valuable impact on lipedema. And I see that Deanna asked, I wonder how long those results lasted if the interventions were not continued the following week. Excellent point, Deanna. Another thing that, it was such a short term, they only did 5 days, and traditional lymphedema therapy, we do it 5 days a week for 3-4 weeks, depending on the severity. And so I would imagine that without any follow-up, without any self-management, that a lot of things could return to normal. But it would be interesting to know that if you didn't do anything, how long do those results last? So that's an excellent point and something else that would be good to look at. Our experience with lymphedema tells us that you have to have self-management practices that you follow up with after you've seen your certified therapist, you need to have follow-up on how you're going to continue to do this on your own, because you're not going to just go forever to the therapist. You want to be able to be independent in your management. And so you have to have those tools that you're going to be able to use when you're at home. And I just also wanted to tell you too, that there's a couple other places that you can get this information when I share with you about these research updates. We have a mini podcast, comes out daily. It's just about 7 to 10 minutes of daily audio podcast that comes out every day. And I regularly do research updates as part of those podcasts. So check that out. That's lymphedema-simplified.org/flash, because we call them flash briefings. So check that out. And also check out our blog posts, because every other week I have a research update blog post, and that's going to be at lymphedema-simplified.org/blog. But really exciting about this month is you really ought to come to our lymphedema boot camp that's going to be June 24, 25, and 26. And you can see the link there to find out more and to register. And I'm just looking at, Carolyn wants to have a link to the study. Yes, Carolyn, I will get that to be posted here. As I said, it was in 2011, published in Lymphology. The Hungarian researcher, I'm sorry, I can't pronounce his name very well, but it is titled Lymphedema Treatment Decreases Pain Intensity in Lymphedema. And I will get you a link for that study that we can have posted along with this update, this research update. Thank you, everybody, for being here today with me. I really enjoyed discussing with you what's new with research, and there has been an explosion in lymphedema research in the last 10 years. So I can't keep up with all the new papers that are coming out. So there's always something new to share with you on this topic, and I look forward to discussing them with you. And if you see a paper that I've missed, please email me, leslyn@lymphedemaproject.org. And if you have a paper you'd like me to discuss, please email me and let me know. Thanks for being here, and I'll see you again next time.